Hey guys, welcome to the Mid Musings podcast. This is the third episode in our series on fertility. Fertility and conception are very important aspects of human existence. It has been estimated by the World Health Organization that about 15 to 20% of couples who are actively trying to conceive experience infertility and difficulty in conceiving. And out of that number, about 40% is down to female infertility. A lot of times, couples don't even know they have infertility issues until they start trying to conceive. In the last episode, I talked about egg freezing for ladies at the age of 20 to 25. This is the time when fertility is at its peak. But I'm sure some of you will be thinking, why does everyone need to freeze their eggs this way? Well, as you know, it's not everyone who needs to freeze their eggs. Some ladies are naturally very fertile and they would get pregnant even after 1 or 2 trials. But if you have an history of infertility in your family, or you are in the middle of starting a career and you feel you want to focus on building that career, then I strongly advise that you freeze your eggs if you can afford to. If you are not sure of what is best for you, consult a specialist in this field and they would let you know what options are suitable for you. Infertility affects both male and females, and it is important that both partners in a relationship get tested for infertility. This journey can be so agonizing, especially in Africa, where family members and friends start asking what is happening once you're married 6 months and they don't see a protruding belly after that 6 months period. And in most cases, it is the woman that is judged as infertile. I stress here, it is important that both parties agree to be tested because it is not only down to the woman, as mentioned previously. Only about 40% of infertility is attributable to female infertility. It is very important that you understand what I'm going to say in the next few minutes. So please stay focused as I continue my discussion on the test that needs to be run to determine the causes of infertility in women generally and the importance of running these tests. For the woman, the test needed will be 1, to check for ovarian reserve level, which I spoke about in my episode 1. The ovarian reserve level measures the number of extra follicles a woman has available, and this declines as the woman gets older. By the age of about 40, we are left with about 15% egg follicles. And by implication, the lower the number of egg follicles available in a woman, the lower the chances of getting pregnant naturally. The second test that needs to be carried out, we need to check if the fallopian tubes are blocked. The fallopian tube is the organ that carries the egg from an ovary to the uterus. Where both the fallopian tubes are blocked, there is no way of achieving a successful pregnancy. But if just one tube is blocked, fertilization could happen through the unblocked tube. But then, this could lead to an ectopic pregnancy. Ectopic pregnancy is an abnormal pregnancy where the egg attaches to other parts other than the uterus where it is supposed to develop into an embryo. In this case, the egg may be attached to the abdominal cavity, the cervix, or to the fallopian tube. The third test that needs to be run on the woman is for a condition called endometriosis. Endometriosis is a situation where the uterine inner lining develops outside the uterus. It could develop in the fallopian tubes. The abnormal position of the uterine lining causes severe or acute pelvic pains, painful intercourse, and sometimes infertility, which is a very big issue. The last but equally important test that needs to be carried out on a woman is to check for fibroids. Fibroids are abnormal, non-cancerous growths in the uterus. They could vary in size from a tiny pea size to something as big as a fully developed embryo. Some women have just one, while others have multiple fibroids. Some of the signs that a woman may have fibroids are pelvic pains, bleeding in between periods, leading to constant fatigue and low energy levels, frequent passing of urine due to the pressure on the uterus, abdominal swelling, and again infertility, where the fibroids are discovered to be blocking the fallopian tubes. The tests I have mentioned are not the only tests available to determine the causes of infertility. There are other tests that medical doctors carry out. These include pap smear, ovulation test, and even testing to check if a woman might be experiencing hormonal imbalance or having sexually transmitted diseases. When diagnosed with infertility, there are a lot of emotions that go through your mind. First, you think this is not fair because people who do not plan to have children, they get pregnant, have children, and then go on to have their family. But you plan to have a child, but you don't get pregnant. You feel let down by the universe because you think the whole world is against you, and basically you don't even have a choice in the matter. Your life feels so empty and you are ready to do anything within your power to change that. Diagnose. It's so bad. But if you're feeling that way, you need to see a mental health practitioner or a counselor. It is very important for your wellness and for your health and safety that you seek counseling. The counselor or the mental health practitioner would help you through these emotions. They could just talk to you and help you understand what you're going through, and they would guide you on what to do. And also, talking to someone sometimes helps you to unburden. So please do not hesitate to contact a mental health practitioner if you're just feeling low and depressed and crying all the time. In our next episode, I will be talking about the test that needs to be carried out on the man. I hope this episode of my podcast has been enlightening. Stay tuned for more informative podcasts. We are still available on Spotify, TuneIn and Alexa, Google Podcast, Stitcher, Deezer, Pocket Cast, Overcast, Tumblr, YouTube, Twitter, and Facebook. Facebook page is Mid Musings, Twitter Mid Musings, and Tumblr. Just search for the Mid Musings podcast on any of the platforms. Keep following, keep downloading, and keep liking. Thank you.